The Arkansas Legislative Council has adopted a hotly debated rule that gives the Arkansas Insurance Department more oversight over pharmacy benefit managers. Now, these companies act as middlemen between insurers and pharmacies to ensure they don't cheat pharmacies out of reimbursements for drugs sold through benefit plans. According to a Federal Trade Commission report, pharmacy benefit managers, 6 of which have control over 95% of drug prescriptions in America, profit at the expense of patients by inflating drug costs and squeezing community pharmacies. Now, Channel 7's Andrew Mobley spoke with the CEO of Arkansas's Pharmacists Association to learn more. Andrew?
Arkansas law requires pharmacy benefit managers to pay pharmacies at least federally set national average drug acquisition cost prices, but the Arkansas Insurance Department says it has received about 1,500 complaints monthly that PBMs illegally pay pharmacies below those prices. According to the FTC, PBMs, some of which own their own pharmacies like CVS, give their affiliates better rates than other pharmacies, stifling competition. The Arkansas Pharmacy Association highlighted today that predatory and exclusionary practices by PBMs have contributed to the increasing closure of local Arkansas pharmacies. 61 in-state pharmacies have closed in the last 8 years, 40 of them in the last 2 years.
We had very black and white concrete examples of CVS paying itself, marking up the price, $63 a prescription, and paying the local pharmacies $2 to $4 below their cost to buy the drug. And then they would send them a letter that said, "We know times are hard, reimbursement's difficult, let us know if we can buy your pharmacy."
The 2018 Arkansas PBM Licensure Act gave the state's insurance department more regulatory authority over PBMs to ensure they fairly and reasonably reimburse pharmacies for drugs dispensed through insurance plans. However, the law wasn't thorough enough to give Arkansas teeth to enforce it. Emergency Rule 128, made permanent today, gives the Arkansas Insurance Department the power necessary to hold PBMs accountable. It gives the department the authority to impose fees on the drug middlemen if they fail to fairly reimburse pharmacies and force them to justify their reimbursement rates.
They hide behind a Byzantine system of pricing that's overly complex, that's very difficult to monitor, very difficult to ensure they're following the law. And by passing a Rule 128 requiring them to turn over their numbers and to turn over their rates, it'll bring a lot of transparency to improve that enforcement.
Emergency Rule 128 was temporarily authorized in September. Yesterday, a subcommittee of Arkansas lawmakers rejected making the rule permanent. This morning, however, the larger Legislative Council reversed that decision.
For patients, it is a win because you've put the access and control back in their hands. If they're unhappy with the service or price, as long as there's healthy competition, they'll be able to access good service at low prices.
The temporary rule is in place until mid-January, after which the permanent variant of the rule will go into effect. On your side, I'm Andrew Mobley.
Well, thanks, Andrew. For more on Arkansas's new rule and the FTC's report on pharmacy benefit managers' monopoly over America's healthcare system, you can check out this story on our website. That's katv.com.